So why do we need a unique nurse identifier? Hospitals and health systems need the ability to uniquely identify nurses in their own health IT systems for documentation, education, research, and training purposes. Also, use of a unique numeric identifier is instrumental to the aggregation, synthesis, and publication of data and research, demonstrating the value and contributions of nurses to better health outcomes. So this is going to enable us to take credit for what we do as nurses, the use of this. Also, widespread use of a unique nurse identifier will enable measurement of the impact of nursing practice on patient and health outcomes. This includes nurses' role in contributing to safe and effective health and care practices and enhancing enterprise resource planning within one organization. Leveraging a unique nurse identifier will enable scientific inquiry whereby researchers can measure and quantify nursing care and its impact on health outcomes. And the appropriate use of nursing resources will also be informed by using the identifier to examine the variability of direct nursing care, time and cost per patient, and the relationships between patient and nurse characteristics and nursing costs. So what are the essentials of a unique nurse identifier? What do we need to make sure is in place? For ease of use and to enable widespread adoption, a unique nurse identifier should be free and automatically generated for each nurse. Public access should be available to enable validation of nurse licensure. And databases that include the identifier should be secure, and updates should be automatic and timely. So in evaluating which identifier to use, the Nursing Knowledge Big Data Work Group selected the NCSBN ID, and we developed a policy statement so we could begin to advocate for use of this ID. And our statement follows here. The NCSBN ID should be used by key stakeholders as a nurse identifier to help demonstrate the value of nursing through research and enhance individual care and health outcomes via more comprehensive documentation in the EHR, ERP, and other technologies and systems. So once we developed this statement, we went to the Alliance for Nursing Informatics to garner their support. And ANIA is a member of ANI. ANI is co-sponsored by ANIA and HIMSS, and its purpose is to advance nursing informatics leadership, practice, education, policy, and research through a unified voice of nursing informatics organizations. A collaboration of more than 25 distinct nursing informatics groups globally, and it represents more than 20,000 nurse informaticists. And it crosses groups that are in academia, practice, industry, and nursing specialty boundaries, and works in collaboration with the more than 4 million nurses that are in practice today. So our policy efforts so far include getting the statement approved, first of all, by the work group back in July last year. And then we had it, we were able to get it approved by the Alliance for Nursing Informatics in November. So now we have initiated our advocacy campaign, and resources are posted on the ANI website, including a policy statement, an FAQ, slides, webinar recording, an infographic, and a bunch of articles that we have had published already. And the policy statement also is informing public policy comments that are submitted by ANI. And you are certainly welcome to go there and make use of those resources. You can find them at allianceni.org. Some of our additional partners include the HIMSS CNIO Vendor Roundtable, the HIMSS organization itself, the National Council of State Boards of Nursing, the New England Nursing Informatics Consortium, and of course the Big Data Science Initiative itself, as well as other ANI member organizations. So what are some of the implications and value of the unique ID for patient outcomes. Today, quality assessment and outcomes research initiatives are hindered by lack of data relating to nursing processes and linking them to patient outcomes. Also, a value-based reimbursement model is going to require a foundational understanding of the impact of nursing practice on patient outcomes in health promotion, prevention of illness, and disease management. Use of a unique identifier for individual nurses within the EHR will enable aggregation, synthesis, and publication of data and research demonstrating the value and contributions of nursing to health outcomes. So this identifier can also be used to measure nursing's impact on individual and population outcomes, patient safety, operational efficiency, resource allocation, and clinical effectiveness. So how can the unique ID create value for nurse outcomes? With large data sets derived from multiple healthcare systems and sources, nurses now have the means to show how they contribute to value-based care.